My feelings are real. My depression is real. My bipolar is real. It's all real. I'm not making it up. Hi, everybody. My name is Kitu. Welcome back if you've been here before, and welcome to the new viewers. I'm trying to bring mental health awareness, and my aim is to really contribute towards destigmatizing mental illnesses. Okay, so today we're talking about depression and bipolar. Exciting stuff. So I tried to do the best I could to make this video as short as possible, but I think with the amount of content I have, it was virtually impossible to make this like a 9-minute or 5-minute video. So I promise this will be the longest one. The rest are going to be pretty short, so please bear with me and stay connected if you can, because we're going to be talking about important issues, and yes, I'm very excited. So let's begin. I'm going to start off by saying that do not Google diagnose yourself with a mental illness. There are professionals who go for training for many years so they can assist us all. So try to stay away from Google diagnosis, and no medical person likes that. So I'm just gonna start off by trying to explain what depression is to those of you who don't know. It's probably one of the most common and well-known mental illnesses out there, and a lot of people use the word depressed quite loosely. I mean, how many times have you heard somebody say, "Oh my gosh, what a day, I'm so depressed," or "this weekend was so depressing," or "oh my gosh," you know, everyone always complains. But depression is a serious condition that may or may not require care. So it's not just that you have a day of sadness or you've had a bad day at work, now you're depressed. No, it's a serious illness. Okay. So according to the World Health Organization, 300 million people globally have depression, and most of these people are females. I think, this is just my thoughts, perhaps males are not seeking care, so that's why there's more women diagnosed with depression than men. So that could be a possible explanation, but I don't know. Okay, so psychiatrists in general and psychologists are the ones that will diagnose people with mental illnesses, and they use what is called the Diagnostic and Statistical Manual of Mental Illnesses. So there's a version 4 and a version 5, and they use this manual basically to diagnose people with mental illnesses. So they don't just pull it off from the top of their head. There's specific criteria that a person needs to meet in order to be diagnosed with a mental illness. Okay, and that's why it's so important, if you suspect you have a mental illness, go seek care, go seek professional care, and the person will diagnose you with a mental illness if you do have one, and recommend treatment if you do need it. Okay, right, so back to depression. So there's a couple of symptoms that a person may present with if they have depression. Okay, so they may have feelings of sadness or emptiness or worthlessness or depressed mood. Okay, they may have decreased need for sleep. Okay, or they may sleep more than usual. They may have increased appetite or decreased appetite. They may suddenly have lack of interest in things that they used to really love doing. Okay, they may have suicidal thoughts. They may find it very difficult to concentrate or to make decisions. Okay, they may isolate themselves. So those are some of the symptoms of depression. And what a psychologist or psychiatrist will do, they would look through the criteria and they know exactly what they need to make that diagnosis. And just to give an overview, you would need to have those symptoms for at least 2 weeks to be diagnosed with depression. So depression may or may not need treatment depending on what your psychologist or psychiatrist recommends. So if it's just a mild form of depression, generally therapy is sufficient, but perhaps a moderate or severe depression may require treatment, which is antidepressants, and the duration of that treatment will depend on what your psychiatrist or your doctor says. Now we're going to talk about bipolar. Okay, so bipolar is a mental illness as well, and it is a mood disorder. Okay, so it's called bipolar because it consists of 2 poles. Okay, so a person with bipolar may either experience highs, which are also called hypomania or mania, or they may experience lows, which is also called depression. And this low is exactly the same as the depression that I just described a couple of seconds ago. Okay, so a person with bipolar will basically alternate between these highs and these lows, and also have normal mood in between. Okay, so I'm just gonna start off with treatment here since my arms are already here. So if somebody presents with a high, the psychiatrist will treat the high, and the aim of it is to kind of bring you down to what will be, let's say this is normal, whatever normal is for you. Okay, and once you're there at your own normal, then you continue with therapy, with treatment, medical treatment, to keep you here. Okay, and then if you experience a low, the psychiatrist will give you treatment to bring you back up. And once you are here, then you continue with treatment to keep you here. Okay, so that is the goal of bipolar treatment. So just remember, bipolar has 2 poles in moods. You're either feeling very high, which means you feel like you're literally on top of the world, like you are Superman or Superwoman. You are the best human being that ever walked this earth. And you may also present with psychotic features if you have mania. And when you have hypomania, it means you don't have the psychosis. Okay. Or you hit the lows. And that is not a great experience. What are the causes of bipolar? So you can't catch it from the air. And nobody chooses to have bipolar. Even depression, nobody chooses to have depression or any mental health illness. Okay, so bipolar. So there are generally 3 elements that researchers have found to contribute towards development of bipolar disorder. The first one is biochemical. So this is neurotransmitters that are imbalanced and hormones that are imbalanced. So this imbalance causes these mood swings, if we can call it that. Okay, so it's not something that a person can physically control. I cannot control my neurotransmitters. I wish I could. How fun would that be? Okay, so that is one element. So imbalance of chemicals, we can call it to simplify it, but it's imbalance of neurotransmitters and certain hormones. Okay, and the second element is genetics. Yes, genetics. So if there's a family history of bipolar mood disorder in your family, and this is your first degree relative, you are at a higher risk of developing bipolar as compared to the general population. Okay, and then if you don't have a relative with bipolar, it does not mean that you are unlikely to get bipolar. You can still get bipolar if there's enough factors that really gets you there. Okay, and then the other factor is environmental issues. So things like traumatic experiences, stresses, all of those can contribute towards the development of bipolar mood disorder. So it's not just one thing that leads to it, it's multifactorial. Yes, so those are the causes of bipolar mood disorder. Oh, now the difficult part. Is it difficult? Yes, it is. My story. Okay, so I got diagnosed with bipolar mood disorder, the type 2. And I think there's a high chance that I was undiagnosed for years. I just did not know that I had a mood disorder. So yeah, I got diagnosed, and I think I'm very happy about it because now I know what was wrong. I used to wonder a lot. I felt like something was not quite there for me. And I think after being diagnosed and finally being on the right treatment, I actually feel so much better, and I feel like I'm more in control of things. So how did I get here? How did I get to my diagnosis? So I think in retrospect, I probably had depression in my teenage years. It was untreated, and it was untreated because I didn't know how to explain what was wrong with me or what was going on in my mind. There was no way to communicate that to somebody. I didn't even know that really there was an issue. I just thought, it's just, life problems, because unfortunately, in most cultures, especially the African culture, we are taught to be really strong individuals who persevere and endure pain, and people get through it. So unfortunately, that's the kind of mentality I've always had, that you need to be strong, you need to endure, you can do anything, you can get through anything. I think that's part of the reason why I did not ask for help. And even during my teenage years, I remember there were times when I felt suicidal, and nobody knows that. Okay, so I guess now they know. And then you find my 20s felt like they were okay. My early 20s felt like they were okay. But I think like my mid to late 20s, I started feeling different, like some kind of way. Like I would have ups and downs, especially downs. I think I would notice the downs more than the ups. And my downs were not like that bad. I would have downs for a couple of days, especially on weekends when I didn't have work. So just do nothing for the whole weekend and or cry the whole weekend, or maybe cry at night some days, but for no reason. I couldn't always explain my feelings, but I would have those lows, and I knew exactly when they were going to happen. I knew the exact time of the year. I could already tell, like, oh my gosh, this month is coming, so I know I'm going to feel these downs randomly. It's going to last for this long, then I'm going to be back up again. I'll be fine. The ups, to be honest, I only noticed or became aware of them once I got diagnosed with bipolar, because my psychiatrist asked me a bunch of questions, and then I was like, oh, maybe you have a point. But to me, like before then, it's not something I really kept track of, because who's gonna complain about feeling great? So yes, but the irritability, now that I have more information, I realize it was not normal irritability. I could go from like 0 to 100 like within a second over something that was pretty small, and so that was not even normal for me. So I had that for a couple of years, not really knowing what's wrong, but thinking something is wrong, but I don't know what's wrong. And I saw a therapist, which has been my therapist for 2 years now. And I saw her and I explained, because at the time I was just crying like for a few days. I'm like, okay, this is happening. I keep doing this. Because I walked in and started crying. I'm like, you need to help me with this. And we talked. We had 4 sessions. And I think my 5th session, I was like, everything is fine. Don't worry, I'm sorted. Like, I'm feeling on top of the world. And now in hindsight, I think maybe it may or may not be right, but I think it may have been a hypomanic episode because I felt amazing. But I could have just been amazing. I mean, sometimes it's hard to tell you with these things. Yes, so although I experienced the mood swings, I don't think anybody else noticed because, I mean, I've lived alone for 13 years of my life now. So nobody really knew what I was going through because obviously if I'm having the lows, I'm not trying to interact with people. I just don't make plans or I cancel the plans. And I didn't tell anybody because I felt like, oh my gosh, like everybody has their lives together and I'm this person just who always has drama. Like, why can't I just feel normal like everybody else? So those were some of the reasons why I didn't share with my friends who are actually quite supportive people. But I mean, that's what I was going through at the time. Yeah, so I think until I had a major, what seemed at the time like a major stressful event, that's what kind of pushed me over the edge. And my symptoms worsened. And prior to that event, I already had symptoms for about 3 months where I would have these like lows, but not too bad. And I had normal days and like a low, but not too bad. But after that, the stressful event, then that's when I really went into full-blown severe depression. And that was the scariest thing in my entire life. That is scary. That is serious. That is scary. Okay, let me just take a few moments to explain how depression feels because I think most people don't understand it. So imagine you are in the darkest tunnel, and that tunnel probably like curves around, and it's, let's just say it's a kilometer long, and you don't even know how long it is, and you don't see any light. And you hear a voice that says, to get out, you need to go that way and just keep walking. But you are in this darkness, like it looks and it feels dark. You cannot even see yourself. And now to even try to stand up, it's the most impossible thing to do. You literally cannot stand up. You cannot lift an arm. And at the same time, you feel so hopeless, like you don't even want to go through the process of getting to the other side where there is light. So it's literally being in the darkest place and you cannot get out. It's not a matter of just being sad. You're not sad. You are in a hopeless place, and your mind is in control of you. You literally have no control. I mean, I love to have control of everything. So this for me has been probably the most challenging thing I've ever had to face in my life because I had no control over it. Like before my hospitalization, like that week before is kind of a blur. And the first week of my admission was kind of a blur as well, until I started to feel better because of medication and all the therapy and all the other classes that we had at the hospital. Then I started to feel like, oh geez, like where, like what the hell? And once you get out of that, whenever you get out of that space, it's almost like it's surreal. Like, who the hell was that? Like, how did I end up there? Like what the hell happened? Why would I think those things? Like, you are a completely different person. It's crazy. Yeah, that thing is just crazy. So, but I think I'm just grateful to now finally be on treatment for something that I did not even know I had. But I got diagnosed because I presented with a depressive episode. And I think since my diagnosis, I've had, I think 3 other depressive episodes. But because we're still trying to figure out the medication, and now I'm finally on the right medication that works for me, and I feel so much better. So there is hope. Don't lose hope. be patient with yourself. If you just got diagnosed, or if it's taken a while to get you on the right cocktail of meds, it may take a while. You're gonna get there. Don't lose hope. There is hope. Yeah, and that was my story. So moving forward, we'll just address other mental health issues, but these will mostly be focused around bipolar mood disorder and challenges and experiences. So yeah, so like my video and subscribe and share it with everybody. Till next time, thank you. Bye.